Hi, everyone. Today we have a special show going on for you because we aren't going to be here this Sunday. So great to see you all. Hi, Mom and Dad. Thanks for being here.
Oh,
Hi.
yeah, it's nice to be here. Thank you.
So today we're talking about, I'm sure, a lot of things, but coffee and talc are in the news today. Yeah.
Yeah, but we're gonna be talking about that. And the reason, well, I'll tell you why I'm going to talk about it in just a minute. But I think that people should know that we are usually on Sundays at 5 o'clock Pacific time on the McDougall channel. And the McDougall diet, McDougall program is very extensive, but it's primarily focused around food because we believe it's the food. And it's real simple. Just to describe the McDougall program to you, the McDougall diet is a diet based on starches like rice and corn and potatoes, with the addition of fruits and vegetables. The McDougall diet does not contain foods from any animal source, be it secretions like in milk or be it animal parts. No. And no free oils. That means like corn oil, olive oil, etc. None of that. And you get to eat as much as you want. The foods are delicious and it's all there. In fact, it's even free on our website. No gimmicks. The program is free on the website, but we'd really like to have a chance to make it happen for you. And we do that once a month or once every other month, depending upon how we're doing and how busy things are. But we do run a 12-day program, telemedicine in your home, all kinds of specialists to help you out. We have a heck of a team. So think about the program, the 12-day program. All right, Heather, I would like to get on to some topics today. And let's see what we got here. All right, how's that look? Pretty good?
Perfect.
What does that say, Heather?
People like to hear good news about their bad habits. Coffee, that's my bad habits.
So who am I talking about? Who am I talking to, Heather? As a matter of
Me
fact,
and many people, we love
right.
caffeine.
Well, we want to put the bad guys where they belong. And the truth of the matter is that coffee's, well, I'll tell you a little bit about coffee. I'm going to tell you the positive things about coffee today. And maybe next week I'll tell you about the negative things. But hey, let's just talk about the good parts about drinking coffee. I think we'll limit to that today. But there are, just mentioned, coffee drinkers, they know where every bathroom is in town because they urinate and even defecate because of the stimulation of coffee. They get very anxious. Sometimes they can't sleep at night. They get terrible indigestion. So they carry around antacids all the time. And you need to know that decaf coffee causes as much indigestion as regular coffee. So you might as well get high, drink the regular stuff. I'm just joking now, folks. Anyway, let's talk about some of the things that I've noticed lately. And this is going to be a very short lecture until I added an extra part to it, Heather. But first thing, we gave a lecture a couple of years ago about dementia and about how to age gracefully. And I tried to find some positive things we could do in addition to food. Food's the deal. You slow brain atrophy, you enhance thought and function and so on if you eat right. And that's all well proven. But what can you do in addition to make your mental health go a little bit better? Well, this article, Caffeine Enhances Memory Performance in Young Adults During Their Non-Optimal Time of the Day. What they did is they fed a cup of coffee, or excuse me, they had students have lunch and then a cup of coffee. And they found out that 30 minutes after drinking the coffee, they reversed their memory decline that was associated with the noontime meal. All right. Caffeine is just one of the parts of coffee. There are lots of other alkaloids involved too. If you want to read about some of the positive effects of coffee on your health, I've listed a whole bunch of them down for you in the right-hand corner. But again, realize there's some adverse effects.
And you say there that I just read tea does the same thing.
Tea gives you a little high.
Oh, well, I mean, you just said right here, so is tea. So I just.
Oh, coffee and tea are linked to longevity benefits. Yeah, tea is too.
Oh, okay.
Yeah, in fact, but I think it's a confounding thing though, Mary, because tea drinkers, what do you think about when you think about tea drinkers? People from England, but who else?
Oh, Japanese.
Yeah, Asian.
Asian.
So I think the confounding factor there, at least in part, is the fact that they eat a starch-based diet. But,
Oh, okay.
you know, I don't think there's anything particularly health or memory enhancing about tea, but there might be. At least some people think there
Well,
is.
the caffeine.
Well, the caffeine's fun.
Yeah, but I mean, if the caffeine in coffee.
Well, but it's not, it's the other alkaloids.
Oh, okay.
That's what I want to separate.
Right.
There's caffeine and then there are other chemicals. We refer them as alkaloids that have other effects. Like, for example, when you take the caffeine out of coffee, you make decaf, you still have other alkaloids that raise your cholesterol and cause indigestion. So, like I say, if you're going to be a coffee drinker, you probably drink it because it enhances your mood, makes you more alert, keener, as this particular study shows right here. So anyway, the other topic that you're hearing a lot about is how you need to stop inflammation. Now, they have this whole thing mixed up a little bit in the sense that they think inflammation is the cause. Inflammation is actually the result of injury. It doesn't cause injury. It's how the body heals itself through inflammation. That doesn't matter what kind of injury you have. It goes through the same processes: swelling, redness, heat, and pain. Those are the characteristics of inflammation. And it occurs after injury, like cigarette smoking or the food, et cetera, et cetera. Anyway, the effort is to have a non-inflammatory body. And that means you're having a body that's not being injured. But what you need to know is that coffee actually has anti-inflammatory and antioxidant benefits. So it reduces the risk of heart disease.
Good.
It's good. I told you I was just going to tell you about good things.
Good. I
People
like
don't have
that.
good news about the bad habits. So anyway, this article came out a couple of years ago. Now, this is an important one. I've talked to you a lot about it, but I wanted to give you the references. And that is, investigators were confused when they did the studies back in the early 90s on coffee and its effects on cholesterol level. And they were all good investigators, and it took a while for them to figure it out. But you can figure it out if you look at that 1997 article in the bottom right-hand corner. It talks about how they sorted this out. What they found is that it's the brewing method. If you brew through say a metal filter, which has big holes, relatively big holes, if you brew your coffee that way, like Turkish coffee, for example, I think that's got that right. So if you brew your coffee that way, it's not Scandinavian. Scandinavian would be the kind that just boils the coffee grounds, and you go through one of these metal strainers. What happens is they found that the cholesterol went up, but if
you went back, there we go.
If experimenters brewed the coffee with a paper filter, then they didn't get the rise in cholesterol. And so that was the difference. The cholesterol goes up about 10% when you consume non-filtered coffee. Look at the bottom right-hand corner. You see the two substances, they're fatty substances. If you put coffee on a counter, you'll notice a kind of an oily film that forms on top. This contains some lipids, fats, and you can actually see it, the shiny stuff. And cafesitol, forgive me, folks, KUEL. Those are the two active substances that raise cholesterol. All right, you see in the graph down here in the bottom right-hand corner, you see the rise in cholesterol that occurred when they were feeding non-filtered coffee. That's on the left-hand side of the graph. And once they switched to coffee filters, paper filters, what they found is a dramatic reduction in cholesterol. In fact, the cholesterol and triglycerides did not go up. Okay, triglycerides went up also. Cholesterol and triglyceride did not go up when they used filters. Now, this is something unique only to Homo sapiens. You look at lesser primates and you do this kind of experiment, you don't find a rise in cholesterol with these two fatty substances. It's just something unique to human beings. And instant coffee has very few of these lipids that raise cholesterol, nor does roasting or decaffeination have an effect. The caffeinated coffee you see as high a rise in cholesterol as you do as you do regular coffee. So again, decaffeinate, just take the caffeine out. You leave the other alkaloids, right? We got that.
Yeah.
The other substances, organic substances behind, the ones that cause indigestion and also raise cholesterol levels. And, here's a picture of the filters that we're talking about. These are various paper filters. What you want to find is a paper filter between 10 and 20 microns. And I showed you what 100 microns look like.
Oh, okay.
So the tighter, the smaller the diameter of the microns, the more filtration that takes place. And it appears to be not the fats that go through, it appears to be tiny pieces of coffee they get through that seem to make a difference as far as carrying these lipids that raise cholesterol. All right.
Interesting.
Last night's headlines. I had to add this just because this is near and dear to me. Last night's this controversy of talc in baby powder has been going on for my entire professional career. I know that. And when I was living in Honolulu, there were some advertisements about how asbestos was so dangerous. They had in shipbuilders, which of course Honolulu had a big shipbuilding yard, they had exposure to asbestos to the building process, and also our schools in Hawaii had walls made of asbestos material. So there's great controversy going on. And what I did is I wrote the Honolulu Advertiser. I wrote them a little note, one paragraph that says, "Why are you guys so upset about the factory workers, the shipbuilders, and the school kids when you're eating tons of asbestos every day in Hawaii by consuming rice?" They threw my one paragraph letter to the editor away. And I wrote them back a month later. I said, you must have lost my letter to the editor. So we threw it out. We didn't want to cause any controversy. We didn't want people to get upset in Hawaii about the fact that what you said, which we don't believe is true, about how there's asbestos in rice. We're not going to print your stuff. So I went to Chapin, George Chapin, who's the editor, and I talked to him for about an hour one evening. And I finally asked him, I said, "Are you a newspaper or not? Don't you want to tell people the truth?" He says, "Well, show me the evidence." Well, I showed him the research papers, the evidence that there was asbestos in rice. And then what I did is I went to a local lab, which could do this analysis. And what I did is I asked them to go buy rice in the regular store in Hawaii. And they bought 11 different samples of rice, and they took it back to the laboratory, and they washed the rice, and they looked at the residue, and they found talc. But what you need to know is that talc is the amorphous form of aluminum silicate, whereas asbestos is the fibrous form. That's the only difference. They're mined out of the same mine. You can't mine one without the other. All right, so I had this laboratory analyze it. We were so broke back then. We were in debt. We were trying to get a couple of kids through school, and finally they did it for me for a ridiculous price. And they were willing to do it. And then they did is they looked at the wash water from the rice, and they kept washing the rice. And with each washing, they got more talc asbestos off than they did the first time. All right, so I showed Chapin this particular letter, and he said, "Okay, you can write something about it." And they had one of the reporters come out and talk to me. Of course, they talked to the rice industry and got their point of view. And here are the articles right here. If you want these articles, we haven't been able to put them in a convenient way for you. But if you write office@drmcdougall.com and ask for these two newspaper articles, we'll send them to you. In this article, the first article that was published, the rice industry said there's no worry about it. There's no asbestos in the rice, and talc doesn't contain asbestos, and on and on and on. It certainly doesn't cause cancer, even though talc-coated rice has been associated with stomach cancer, particularly in the Japanese. All right, so anyway, after I showed them all the evidence and how the rice industry and their expert was completely wrong, they allowed me to write the next article that you see there, which is about talc-coated rice and asbestos. And this particular article I wrote was uncontested. If you see the picture here on your right, you see the amorphous particles. That's talc. But do you see the fibrous ones, like where the arrow's pointing? That's asbestos. You can't mine talc without mining asbestos. It's just a different physical form. All right. Well, anyway, Johnson & Johnson, they banned talc in 2020 in the United States and Canada. They waited till 2023 to ban it internationally. And the article that appears yesterday and today in the newspaper is about how they banned it. But I want you to know, back in 1978 and 1979, I made the public aware of this problem. And they've gotten away for the last 45 years. They've gotten away with selling baby powder that they advertise as having talc that contains asbestos to the public.
Obviously, they know it, or they wouldn't admit to it that they're paying out all this money to people. So it's not like they're denying it. They're just saying, oops, sorry.
They ignored it for 45 years, Mary, after I talked to them. Do you remember when we were living in Kailua, and in a little house that we were renting back in 1978 and 79? And I don't remember if you noticed or I told you how I felt about it, but I was afraid. You know, once I published this article, you know, I closed all the windows and locked the doors. I said, you know what, they're going to come after me. Well, that was my first lesson in how they're not going to come after me. I don't really care. Unless I make a big controversy about it, bring it to the public's attention in great form and publish it in the Honolulu Advertiser, obviously was not enough. They're not going to bother with me at all. So you wonder why I get away with all the stuff I get away with is because I'm not making a difference. If I was making a difference, they would come after me, not only because of my beliefs in medicine and nutrition, they would go after my personal life. They would go after my friends, and you know how they are, right? You know, politics. Anyway, it just shows you how ineffective I am. But you folks, you thousands of people who are listening to this presentation, not just about this issue of talc and asbestos and so on, but all the controversies that I brought up for you over the last 48 years. I've been spreading this good news. You know, you can pretty much figure that unless I get their attention, I won't be involved in any controversy. And I want your help. You know, tell people I want your help about mostly the dietary issues. The talc and rice is a minor issue. Just gives you an example of how one person can make a difference. Anyway,
Well, you didn't finish the story about how after you did this, they took all the asbestos off.
oh yeah. After the second article I wrote, within a couple of months, you couldn't find talc-coated rice in Hawaii, Puerto Rico, or California. They completely got taken off the market. And that's why I say one person can make a difference, you know. So
Well, they coated it with sugar or something.
right. See, the reason they coat it with talc is that when you take the brown covering off, which protects it from various vermin, you know, molds and bacteria and anyway, insects, etc. Once you take the brown coating off of, then the nugget of carbohydrate is exposed and it easily spoils. And so what they did is they coated it with a coating of glucose and talc. Okay, they stopped using the talc as of 1979.
But you know, the reason they do that, and then I noticed you said in Hawaii and Puerto Rico and California, is because those places, the weather's warm.
Yeah.
When we lived in Hawaii, I had extra refrigerator and I stored all of my grains in the refrigerator because it was too hot.
Yeah.
The bugs ate everything.
It wouldn't eat any of your talc-coated rice, so we didn't have any in the house.
Didn't have any talc-coated rice, but the bugs eat everything.
Yeah.
And so that's why they coated it in the first place, I think.
Yeah, that's right. That's why they put the coating on. But now they just put glucose on. Anyway, if to repeat myself, if you want these particular articles, just write info@drmcdougall.com and we'll send them to you. But you may be able to read them as it is on the screen if you can make it big enough. All right, Heather, that's it. That's all I wanted to say to get started out on this particular evening.
Thank you.
Yeah.
I do want to say that you are making a difference. You said you are
Yeah.
making a difference. You are. I know it's not as big as you'd like it to be, but you're changing people's lives. So
Well, thank you,
we
Heather. That makes
appreciate you.
me feel good. But I would rather put it as we are making a difference because, it's been Mom and I for all these years. And for the last 20 years, it's been you, Mom, and I. And I think with the three of us working together, we can do it. I think, quite honestly, Heather, I think I come across a little bit harsh and a little bit threatening to people. And to have you and Mom right by my side, they look at me and they go, "Hey, he's probably a decent person. He ain't so bad." If I've got these two nice people. And besides that, you look so good, Heather and Mary. You guys at any age, but you're nearly 50, Heather, and Mom's nearly 80. Aged you a little bit, didn't I? You're
Thanks.
77.
No, I'm 78.
78. I'm
Yeah, it's
77.
pretty close to 80.
Yeah, she's pretty close to 80, folks. I forget sometimes too, because she looks so good and she acts so well and so functional. I always thought people at 80 were old and decrepit. Boy, this has given me new faith in 80-year-olds, I'll tell you that. Because if we can do as well as we're doing, I bet other people at 80 can do as well as they're doing too. I wouldn't worry about it. I want to tell you, experience outweighs any loss of mental capacity that I experience or many other 80-year-olds experience. So don't hold age against us. We have experience. Maybe we don't have a fresh mind that traps every new idea, but I think only the good ideas get in when you get to be at my age. The bad ones you've already figured out are bad. Anyway, you got some questions, Heather? If we can have some fun.
I do, lots coming in while you were giving your presentation. I actually have a few that were emailed to me, which is great. You can always email questions to office@drmcdougall.com. Diane writes in, she's a grandmother. She's been diagnosed with glossopharyngeal neuralgia and trigeminal neuralgia. All you people give me these words that are so difficult. I'm an English major. Temporal arteriitis and giant cell arteritis. Okay.
This is a tough one, Heather. I have never been able to successfully treat temporal arteritis.
What is it?
Well, right here is the temporal arteries right here in your head.
Okay.
And it gets inflamed and painful, and they say it can affect the eye. And I guess in this person's case, it's affected all the way down into the back of their throat and the esophagus, because she's got pain in this area. It's horrible pain. And as I say, there's a great fear about the inflammation going to the eye and causing blindness. Now, I don't know how true that is, but I know the warning is strong enough so it makes me act like I was trained. And that is that I would give steroids for a year. Usually a year is enough. And then the inflammation kind of goes away. I've tried diet with these people. I've tried the elimination diet. I've tried everything. And I've never had a success rate with temporal arteritis. So all I can tell you is put your urine with high dose steroids. And hopefully by the end of the day, it'll be over. And you'll have used all of this experience to further convince you that you need to take good care of yourself. And, there are a lot of problems that are correctable. Most problems are correctable by food because they're caused by food. But you got me with temporal arteritis, giant cell arteritis. So.
Thank you.
Fortunately, I don't see much of them. I've probably only seen 10 cases in my whole career, Heather. I'm just guessing, maybe 20. But so I've had a chance to try a good diet. And that doesn't work out. Just like with Raynaud's phenomenon, that's another thing.
Raynaud's.
There are some of these artery problems, and Raynaud's could be related to temporal arteritis. They're both due to spasms of the arteries and inflammation. One being very temporary, induced by colds, which is Raynaud's, and this one persistent all the time. And I don't know of any temperature that affects it. So.
Thank you. Next question, Shannon wrote in, she's really interested in taking our online course, but is concerned because she has both histamine and FODMAP, the FODMAP intolerance. Can you comment on that?
It's not the way we practice. This is a way was it FOB?
FOD. FODMAP.
FODMAPs.
It's
What they
like,
do is they take certain carbohydrates out of the diet. You know, I can't figure how that would work out for people. It's mostly with gastrointestinal diseases like irritable bowel syndrome, and it's also been used to treat inflammatory bowel disease, but I don't know how successfully. I can't recall any research that shows anything but minor improvements by taking this approach. And as far as histamine goes, again, you know, you're taking it on tangents that I've never used because, you know, they've been so impotent. So it's such little benefit to take this philosophy. But as I always tell you, when people share something with you and you think they're credible and it's not going to kill you, and you have the time, money, and effort to spend to test it. See what happens. The other thing you can do is you look up the carbohydrates, the histamine foods that are identified in these two programs, which again, I don't believe in, but then maybe I don't know enough about them. I think I do. I've read about them and, you know, seen enough people who have not been successful to know that at best it is, the benefits are minor. And because they head you in a direction towards more carbohydrate, less meat, etc., maybe the benefits are all from similar things that we recommend. But anyway, try either one of those programs, give them 4 months. Or what you know, if you came to me with your symptoms and signs, which I don't remember Heather telling me, but I would have gone right straight through our diet, a starch-based diet. You avoid wheat, barley, and rye for the celiac issues, and then you do the elimination diet, and it'll work out for you. I can't imagine it wouldn't work out for you. And the benefits should be pretty darn dramatic. You shouldn't sit and wonder, oh, does the McDougall diet work, or am I expecting too much out of it? No, you'll find out that it's, you know, very, very potent treatment.
like you just said, it didn't work for people.
Our diet does, the elimination diet.
For what she's talking about?
Yeah. Yeah, the histamine diet and the FOB was the FOB.
Yeah, I don't know, FODMAP or.
Yeah, there's various carbohydrates. Yeah, you know, I've never seen anything come out of those, either one of those approaches that I want to incorporate in my practice.
Okay.
Okay, but like I say, they do tend you towards more carbohydrates. So, you know, that's good. They just identify certain carbohydrates that have a particular whatever effect.
Well, could there be something in certain carbohydrates that bother certain people?
These people believe that, but the reason I don't is because there have probably been 10,000 different kinds of starches that human beings have consumed over the last million years. And if it was troublesome, I mean, seriously troublesome for some of these carbohydrates, I'm sure they're the histamine, the FOB.
FODMAP.
FODMAP.
I don't know.
Anyway, I'm sure many of these populations have consumed foods out of both those categories and have successful civilizations that lasted, you know, 1,000 years, involving millions of people. So you're trying to explain to me that this is somehow something that's important only in the 21st century, you know, when it hasn't been important for people for the last million years? I doubt it.
Okay.
At best, you're going to have a small benefit. You're not going to be impressed. If you are impressed, let me know. Give me some evidence too. You know, I'd like to see the swollen joints go away. I'd like to see, you know, hear about how the bowels are working really good now. Yeah, let me know.
Thank you. Next question. Jim wrote in, he is a healthy 57-year-old male, eats the McDougall diet, but in the evenings and throughout the night, he's troubled by frequent urination. Would you have any comments on that?
How old did you say he was?
57.
Well, he's a little young, but BPH is something that happens, benign prostatic hyperplasia, or hypertrophy, BPH, they call it, benign prostatic hyperplasia. There's an article on the website. You will go to Hot Topics, Medical, and it's under prostatic hyperplasia. Easy to find. It's an article I wrote to deal with frequent urination, which is common. I would say well over 70% of men have this difficulty as they get older. And what it means is you can't empty your bladder all the way. And so you have retention of urine. And so that only leaves you a small amount of space to fill the bladder completely. And then you feel the sensation to urinate. So it's just a matter of not being able to get this urine out of the bladder. And you have urinary retention. And so you get up 6, 8, 10 times a night to try and at least take a couple ounces off this distended bladder. And is there an easy way to deal with it? Well, this article I told you does help you. And it starts out with fluid restriction. And that means you just don't drink a lot of liquids. And it reduces the amount of urine you produce, obviously. The other thing you might do is there's something called the walking phenomena, which is when people have this problem, if they urinate, we're talking about men, of course, when they urinate, if they get up and go for a walk, not a long walk, 100 feet, 50 feet, then what happens when they get back to the bathroom is they're going to be able to urinate more. So you can use that to kind of get the bladder fully empty and reduce the amount of frequency of urination. Then there are some herbal things like saw palmetto and some of the sterols, and they're listed in this particular article that you might try. Again, I have to tell you, my personal experience has not been great in terms of taking care of men who try saw palmetto. I'm just not that impressed with this herb. But if it works for you, it's relatively inexpensive, relatively safe, and give it a try. But don't be surprised if you don't have the return to youth that you expect. Then the next stage you go on to doctor prescribed drugs, which are alpha adrenergic blocking agents like Flomax. There's a new one comes out. It came out too, which has less adverse effects. And that's supposed to shrink the prostate a little bit to make urination better. Then you have some anti-testosterone drugs, which are prescribed, which reduce the amount of testosterone. I can only imagine that if you have any sex life left, it's probably going to be gone after that. And in that way, by taking the effect of testosterone off the prostate, which is the stimulus for hyperplasia, for overgrowth, that helps. And then the next phase you go on to is minimal surgeries. And these would be laser surgeries. There's an ultrasound treatment that you might want to try. There are all kinds of new things. They've got these little plastic pieces they put in your urethra these days. They have a lot of different treatments. And what that tells me is they don't have any really successful treatments, or they just stop inventing them and advertising them. They're advertising them on TV. And then the last thing, and they're getting back to this, I can't believe it. It's called a TURP, transurethral resection of the prostate. Oh man,
I remember those. Yeah, that was years ago.
But they're still doing them there.
I know.
And you're going to be impotent once you have this procedure done. They take the prostate out either through the penis or through the abdomen. And my memory of people who've been through TURPs is a man laying in a hospital bed with a catheter placed in the bladder, with the catheter having a little bit of weight put on it so that the bulb of the catheter pulls against the area the prostate was in. So you kind of got this weight pulling on this catheter, which has this bulb which blocks off the bleeding, and you lay there for like 4 days until the bleeding stops. Anyway, it's just hopefully you can do it with as conservative a way as possible. But I've seen people get into trouble where they've had to have emergency prostate operations. I had a really, really good friend. He was a natural hygienist. This was back in Honolulu. So, I mean, he really ate strictly. I know he did. And he kept delaying and delaying and delaying. And finally, I got a call from the hospital that he was in for emergency surgery. And of course, they fixed him, but probably did a TURP on him. I can't remember that. So it can get that bad, but it's pretty rare for it to get that bad. There's no reason not to delay. Well, there is a reason. It could get that bad. I mean, this man, before he had the emergency surgery, he had backup of fluid into his kidneys, and that's not good. To have that can result in kidney damage. So he had that before he went for emergency surgery. So you'll know when you get into trouble. The body has a good way of letting you know when it's time to get some medical intervention. Coffee,
you.
stay away from coffee too. That makes you urinate frequently. We started talking about that at the beginning of this lecture.
Next question. This is from Rob. What would you say to people who say our diet is low in choline, and that could be an issue because some studies say it could be linked to dementia?
Yeah, there are people who believe that choline is from meat, just like carnitine. Okay, well, just animal products, choline is. And choline turns into TMA, trimethylamine, in the gut. If you're a meat eater, okay, meat, any kind of animal products, or if you take supplements of carnine or choline, what happens is in a meat eater, they grow bacteria in their intestinal tract that will convert this carnitine and choline into trimethylamine. Trimethylamine stinks. We call it fish odor syndrome. And it's one of the causes of chronic bad body odor is this particular mechanism. So trimethylamine stinks. When it goes from the gut, remember, only meat eaters grow bacteria that make this conversion. Vegetarians don't. So you don't convert it to trimethylamine, which is in the gut. Then it goes into the bloodstream, and in the liver, it is oxidized into trimethylamine oxide. Trimethylamine oxide is associated with a dramatic increase in risk of dying of heart disease. So, dementia, doubt it. Evidence is weak, to say the least, versus pretty well known effects of stinking terrible, like fish odor syndrome, they call it. It's trimethylamine urea. It's a genetic condition, but Americans have it chronically all the time. They just stink. And, heart disease, balance the two. And by the way, they sell supplements of choline and carnitine. And those are the ones that are telling you it's so good for you.
Thank you. Next question. This is from Nicole. She has some heart issues, but also suffers from esophagitis. Do you have any comments on that?
Well, yeah, esophagitis and heart issues can be confused because the pain is in kind of the same area. I would say esophagitis is probably not like an elephant sitting on your chest, which is what, a heart attack is. But then I say that in somewhere between 10 and 12% of people have heart attacks and don't have any symptoms. So that could be the case too. Probably the story of this patient went like this. She went to the doctor with complaints of indigestion. He didn't think it sounded like typical indigestion. So he sent her to the cardiologist, who probably sent her to the cath lab after a few tests, and did an angiogram on her, and then wanted to do an angioplasty, but didn't find anything significant enough to either diagnose heart disease or to do an angioplasty. So that's how, by exclusion, the doctor said it's indigestion. Another way to tell if it's indigestion is to get rid of the indigestion. But the problem is the same diet that gets rid of the indigestion also gets rid of the chest pain. So you get a little confused there. I showed you research done in the 1960s, by Peter Quo, Dr. Williams, and a few other researchers. They did research in the articles are in my heart disease lecture. You can look it up on YouTube. The articles are there that show that when you eat a high-fat diet, it precipitates angina. So, you get chest pain from just sludging the blood and eating a high-fat diet. Well, so say you change your diet and eat a starch-based diet like we recommend. Well, that'll stop the chest pain from narrowed heart arteries. It does so. I mean, look it up. And but it also relieves indigestion. All right, so let's just end this discussion with how you treat indigestion. First, you start out by getting all the animal foods out of your diet, because indigestion is often a condition of high acidity, acid, in the stomach. The reason the acid's there is to digest protein. Carnivores, like a cat, has 7 times as much acid as we do in their stomach. So when we try and eat like a cat, the stomach tries to produce this extra acid to digest cat food. And as a consequence, you get an indigestion. The other thing to know is that dairy products actually cause a stimulation of acid production. So the first thing you do is you get on a starch-based diet without the animal foods. And then the next thing you do at the same time, you raise the head of your bed. And then you avoid certain vegetable foods that are troublesome. And these would be raw vegetables, all raw vegetables, but particularly onions, green peppers, cucumbers, and radishes. Terrible indigestion from raw onions. I can tell you that from my own experience. And so you eat only cooked food, starch-based diet. And then the next step is to take wafer antacids like Tums or liquid antacids like Tums, and to see if you get symptom relief that way. And then there are H2 blockers. They're called H2 blockers, such as Tagamet. And they're over the counter. And I would recommend that as a next step, with a lot of hesitation. There's a lot of research coming out now that shows these H2 blockers have some pretty serious side effects. But the one that I really discourage you from taking are the proton pump inhibitors, like the Nexium and the Prilosec and the Prevacid. Cause increased risk of fractures, lung cancer, pneumonia. I mean, I can't think of much good to say about them, except there's a few people desperate enough that following the advice that I just gave, don't get relief. And I've had a few patients over the years who said, look, I did everything it said. I think my patients tell me the truth, by the way. I don't sit there and say, well, you're lying to me. I have to assume that you're telling me the truth when you tell me that, because otherwise, how can I help you? So I assume that, and they say, well, the only way I can make it through the day is to take my proton pump inhibitors. Well, fine. In that type of situation, you're only left with one choice. But I have to tell you, 99.99% of the people I've taken care of who have chronic indigestion, GERD, reflux esophagitis, they get relief, complete relief by changing their diet.
Thank you. Next question. This is from Mama Kay. She's wondering how you feel about methimazole daily to suppress the thyroid gland.
Oh,
she told her, yeah.
Propylthiouracil.
Okay.
It's similar. I don't know if it's the same drug as propylthiouracil, but but there are two drugs. I think this is the other of the two drugs. I've always used propylthiouracil. I think it's a good choice. And what this drug does is it blocks the effect of thyroid. And so here you have symptoms of hyperthyroidism. You're losing weight, you're losing muscle, you have, and what else would you have? That you're not feeling good at all. And you go to the doctor, and the doctor says your TSH is really low, which means you have either overactivity of your thyroid gland or you're taking too much thyroid medication, because that makes the TSH go low, not high, but low. Okay, it reacts like a reciprocal reaction. Okay, so you got it from taking too many thyroid pills, or you have a condition of hyperthyroidism, which I don't know the cause. And I've been looking at the cause for, like I say, 48 years. The best I can come to is it's some type of environmental pollutant that poisons the thyroid gland, but I'll leave that open for discussion. So how do you treat it? Well, you've got three choices. One is you can take propylthiouracil or the other drug that the lady just mentioned. You take that for a year. 40 to 50% of people, just in that interval time, when you suppress the symptoms of hyperthyroidism, just during that period of time, 40, 50% of the people are cured. They are euthyroid at the end of a year. So it makes sense to me that you at least give yourself a year to see if you get better. I don't know that this has anything to do with diet. All right. It's just a matter of waiting. Then you're left with these options. Two options. You can either have the thyroid removed, and when they do that, they almost always remove too much. So you almost always have to take thyroid medication afterwards. Or they can give radioactive thyroid 131. And in that case, likewise, they're going to destroy the whole thyroid gland. You're going to be on thyroid supplements the rest of your life. So I would say just thinking about all the different things, the inconvenience of surgery and the risks of surgery, I'd probably take the I-131 treatment. If the hyperthyroidism did not resolve on its own. And you check it by your TSH level. But again, with both of these treatments, surgery and I-131, chances are you're going to end up hypothyroid. They're going to take away too much thyroid gland because it's too hard to guess what's the right amount. So they overtreat. Because it's better to overtreat and give. I used to thinking it's better to overtreat and give you the pills afterwards rather than have to send you back for the radiation or the surgery again. Maybe that's the thinking. Anyway, that's the way it works out. We had a next door neighbor who, you know her, Heather. She developed hyperthyroidism. They had an RV, and her husband drove her down to San Francisco to get the treatment, but made her ride in the back of the RV on the way home because he's afraid he was going to get radiation poisoning. And they tell you to stay away from other people right after the injection. So that's the way he handled it. He took his RV down to pick her up. Remember that?
Yeah, I do.
Anyway, I could give that person as an example how somebody can do everything, as far as I'm concerned, wrong and do well. She's alive and well. And she, based on my predictions, which you can tell I question my predictions, she should have been gone 20 years ago.
Thank you. That's all very helpful. Okay, next question. Eli's writing in, he eats the McDougall program, starch solution, low fat, but experiences frequent headaches like migraines. What could be causing that? Do you have any ideas?
An article, what is it? There was an article today about migraines.
Oh, I missed that one.
Yeah, maybe it was, I switched between the newspaper and the National Library of Medicine so effortlessly that sometimes I don't know what I'm reading. Anyway, yeah, it's a tough one. I have to say I have had patients who I know follow the diet who they still get migraines. And I know they follow the program. There's no question in my mind. But I also know people who claim that they have gotten relief of migraines by following the diet. And I believe that. Like I say, but I can't predict who's going to be in which category, success or failure. There are some good drugs out there for migraines that you take to either prevent or to mitigate them. And these are, they have a lot of side effects to them. I have to read about them to remember what those side effects are. But, there's at least some modern treatment. The other thing is for frequent migraines, recurrent migraines, we used to give a beta blocker like Inderal. Again, I'd have to look it up to see what the success rate is that, but you might look up Inderal or beta blockers and migraines to see what the current research shows. And I don't know, otherwise, symptomatic treatment, like opioids or non-steroidal anti-inflammatory drugs to help with the pain to get you through it. But I even have people with cluster headaches, which are what are called Horton's cluster headaches, where they're just incapacitated. I think people later right now said that, it changed your life once you change your diet. Go figure. Do the same thing I've told you to do many times before, is give us a chance. Eat a starch-based diet strictly for a period of time. I don't care. Give it somewhere between 7 days and 60 days. Let's see, it would be 120 days. Give it a try. Cost you nothing. Likely you will risk nothing by delaying your treatment, except for maybe a bit be symptomatic and things won't work out because the program didn't work for you. But I think it will. Usually it does.
Thank you. Next question. This is from Locanine. They want to know what to do if no matter what you do, your total cholesterol won't budge from 200. Are statins the only option?
All right. And I want to make absolutely clear for you is that we have drugs that lower cholesterol, but we don't have drugs that make a big difference when it comes to risk of having a heart attack or dying from heart disease. And when I say a big difference, there are drugs like aspirin, for example. If you are really, really sick, in other words, you've had a heart attack, bypass surgery, maybe a high calcium score on a CAT scan. I mean, if you and I sit down and say, I better do something because my past history says that I'm in big trouble, then I'll take off 3 people with a baby aspirin a day. And that's kind of relying on my old training too. Plus, these are the current recommendations. So it makes me feel a little bit better about doing this. Put them on baby aspirin a day, and I'll put them on statins. I don't use statins in otherwise healthy people, regardless of their cholesterol number, because it's just a risk factor. It's not that cholesterol causes the disease, causes the arteries to become sick. It's that the diet that raises your blood cholesterol makes the arteries sick. It's the whole diet. And the proof of this is the fact that when you look at the research papers, and you can see those if you watch my lecture on YouTube on heart disease, I put them all there for you. You can see that statins cause almost no reduction in risk of dying of heart disease, even for those people who are really sick. It's a matter of just a couple of days, not a big deal, but it's enough so that I would not fail to recommend to you to take statins if you had a high risk of stroke or heart attack. But if you don't, in other words, you're a relatively healthy person with a cholesterol of 250, 300, I don't know that it really makes any difference. I would not treat you because, well, first of all, you've declared that high cholesterol has not resulted in horrible disease because you're still alive and you don't have that history. So for you, the cholesterol number is not closely attached, not very relevant. Do you see what I mean? And it's kind of like as people get older, as people get older, the correlation between cholesterol and risk of dying is eliminated. And the reason is those who cholesterol accurately reflected the condition of the arteries are dead, leaving only those people alive who have high cholesterol who it really didn't matter. And that's why in age groups, say above 65, there's no correlation between cholesterol and your risk of getting dying of heart disease. You already killed it. The sensitive ones already died, the ones that matter. I have a couple of patients that I can think of which provide good examples of what I'm talking about. And I have a couple of patients I can think of who, probably more than that, maybe 3 or 4 actually, who had really high cholesterols in the 350 range. And we did CAT scans on their heart scans and looked at their arteries, which is a pretty accurate way of looking at the arteries. And we found their arteries were baby clean in each case and no artery disease. Dean Ornish, who publishes his studies on reversal of heart disease with primarily a diet, says there's no correlation between reduction in cholesterol and whether or not the participants got the benefits. The correlation was only with their compliance with the diet. Well, how well did they follow the instructions? Based on that score, you were able to predict whether or not they saw a healthy person with cleaner arteries, not based on what their cholesterol was. Anyway, if you want to see the number lower and you don't care about the fact that cholesterol is only a marker, a risk factor, and that lowering cholesterol is not going to reduce your risk of dying of heart disease. That's what the research says consistently. Minor exception with statins. You just need to see a better number. Well, you should probably take something like gugulipid or psyllium or garlic, or there's a new berberine, B-E-R-B-E-R-I-N-E. Just taking Miller's brand, fiber will lower your cholesterol. And that would be probably a healthier way to do it than taking statins. So, there's also bile acid sequestering agents. Anyway, we'll get into it. The important point is that you can make the number lower, but that does not translate into better health. To get better health, you have to fix the problem, and the problem's the food, which results in almost everybody a reduction in cholesterol that you see on your blood tests. But the important thing is you are healthy because you fix the problem. Okay. to take care of the average person, you have to have them. In fact, there was something called the poly pill. You look it up, poly pill. It got a little popular in Europe. It contains 7 different medications that were associated with a lower risk of dying of heart disease. They were 2 blood pressure pills, a diabetic pill, a cholesterol pill. Let's see what else they get. Vitamin E, I think, and an omega-3 fat. Anyway, you can look it up. It's a poly pill, it's called. And they were to be sold over the counter. They never took off. I think for 2 reasons. One, the drug companies were upset because they took business away from them. The poly pill did, because you could buy it over the counter. And secondarily, the benefit risk ratio was not there for the poly pill to become popular. So the average patient, the typical patient, needs to carry around a bag full of drugs. You got to have something for constipation, and then an intermittent diarrhea. You got to have something for that. A whole bunch of painkillers for the aches and pains that you have. You have to take a drug to lower your blood pressure, maybe 2 or 3 drugs. Yeah, some of you are on 3 or 4 drugs to lower your blood pressure. You have to be on 2 or 3 or 4 medications to lower your blood sugar. You have to be on a cholesterol lowering medication. You see what I'm saying? But you think that this is just an abstract. These are the people that your doctors are seeing. They're on these bag full of pills, trying to chase around all these problems that are tied to bad eating. And they never catch them. They never fix them. They may be able to mitigate the symptoms a little bit and the signs a little bit, but just until you fix the food, you haven't fixed the problem. Then all of a sudden, you don't have high blood pressure. You don't have high blood sugar. You have a nice poop every day. You feel good because you fixed the problem. What do you deserve? What do you deserve? What do you want? You want a bag full of pills and a bunch of excuses, or you want to get well? Give us a try. All I ask is you give us a try first, and then go take the bag full of pills or go off to the surgery. There's lots of, most of the profession is waiting for you. Yeah, they're going to charge you a big bucket of money for it too. And we give it to you for free. Oh, that's the problem. We'll give it away for free. Yeah.
I love that we do that. We have the free option, we have the mini courses that are a bit more money, and then we have the intensive 12-day that has all the medical care and live education. So, regardless of how much money you have, you can access the McDougall program. So it's all on our website, drmcdougall.com. Let's see, we've got 2 minutes. Oh, go ahead. Sorry.
I was going to say pretty much everything I know I've written down. So it's either in the books or in the newsletters, or I've spoken it, and it's on a presentation that you can find on YouTube. Just go to YouTube, the McDougall channel, put in your problems: liver disease, kidney disease, heart disease, breast cancer. Just put in the problem. I've given a lecture on it. I have well over 200 lectures up there. I don't have any, by the way, there's very little new I have to tell you. So it's time. You don't have to sit around and wait. Well, maybe he'll change his mind. All right.
Well, I think it's great that every Sunday at 5 p.m. Pacific, you bring us all the latest news and really bring your research and what you've been saying for decades up to date. So thank you.
Well, it's only been 45 years that it's been made public that talc is really asbestos. They're only 45 years late. Anyway, as I mentioned, you can have copies of those articles right to office@drmcdougall.com if you're interested in the news, or look them up. Go to the Honolulu Advertiser, put in McDougall and talc. Yeah, they have an archive there. Do that.
Thank
Give you a
you.
little education and some of the other things I did in Honolulu too. That wasn't the only controversy I was involved in.
No, gosh, you could talk all about breast cancer. That's a whole nother show.
Yeah.
Yes, it is. And someday,
Okay,
Heather,
well,
I'm
sorry.
going to write these stories down someday.
Oh, we would love that. Be a bestseller.
I hope.
He's working on it.
I'm working on it.
Time's up. It's been an hour.
It
Thank
was
you
a
for your
pleasure.
time.
Thank you, Heather.
So we won't be live this Sunday in honor of Father's Day. So happy Father's Day, everyone. And we will be back live June 23rd at 5 p.m. Pacific. So enjoy your week, everyone. Thanks, Mom and Dad, Dr. McDougall and Mary.
Thank you, Heather.
All right.
Bye-bye.